is Chris Binks, and I've said that I would do this short video testimonial just to talk about my experience at Edward House Dental Practice and give a bit of background to some of the treatment I've received, and maybe talk a little bit about the onlays and the implants and the sedation, etc. I've been a patient at Edward House for several years, and normally it's the lovely Claire Shipley who gives me excellent treatment, but I had a really nasty cycling accident 3 years ago, almost to the day as I speak, and I was looked after not only by Claire but also by Jason and by Chris, and some of the treatment was here at Edward House, but other parts of the treatment were at the Brough practice. Actually, I was cycling to a private French tuition lesson one Thursday evening in November 3 years ago, as I say, and I was hit by a careless driver who just pulled out from a side road, despite there being bright lights on the bike. But she did the decent thing. She stopped and she never contested liability. The dental problems which I presented for the team here were significant. My upper jaw was broken, so Jason wasn't able to, what's called a Lafort 1 fracture, so Jason wasn't able to embark on any treatment for about three months. It might even have been 6 months, I can't remember. And I also I lost 2 teeth, and one of them came out quite easily in a big operation I had at Hull Royal Infirmary, but the other one was kind of knocked back at 45 degrees, and both teeth were removed in this operation. But the one that had been knocked at 45 degrees approximately, I think it presented Jason with some particularly tricky problems, but he overcame them, and I ended up with 2 implants, and it's just like having your own teeth. And in fact, while it occurs to me, I had to go to a private hospital in Leeds for a consultation with a maxillofacial surgeon who assessed the impact of scarring that I've got here and down here and here, because in my face there were multiple facial fractures, not just the upper jaw. When he also looked at the dental treatment which mainly Jason had done, and to begin with he couldn't tell which were the 2 implants, and he said that everything, including the onlays, were really, really neat. And when I came back, I was dying to tell Jason as soon as I got back. Jason was well pleased. He said, "I'll take that any day from a maxillofacial surgeon." Sedation was required, and that was a bit different from the occasional anaesthetic I've had in a hospital situation after an injury, in that I just wake up from anaesthetic, whereas the sedation I was quite groggy and sleepy for half a day afterwards, but you don't feel anything, and it's just like having your own teeth. Implants are brilliant, as well as the 2 teeth which I lost. There was a root canal to do, which actually Chris Mayer did, and he did that brilliantly as well. I get the impression, without being an expert on this practice, but I get the impression that individuals like Claire and Jason and Chris have each got their own particular area of expertise, and if it's a bit like me, I teach French, I don't teach German. If you need to learn German, go to somebody else, and I get the impression it's a bit like that. So Claire does her thing and Jason does his thing and Chris does his thing. Chris did the root canal treatment, and he showed me on a big screen, like a TV screen, just how he'd managed to fill it's a bit like a glorified filling as I understand it, and he'd really got it to within a millimetre of the root, which is where he wanted it to be. And something else I mentioned while it occurs to me is that I get the impression that at this practice and at the Brough practice, they're not afraid of pushing the boat out in terms of spending money on really up-to-date, state-of-the-art technology, but not just have modern toys. It's going to enhance their professional expertise as dentists. At every step of the way, yes, the next part of the treatment was explained, and there was sometimes a bit of a gap, but it was for a good reason. And then when things had settled down, there was more work to be done, and other problems which Jason resolved, which you just don't think about when you're a human being, is that when you're born with nature gives you the ability just to chew things on either side of your mouth, and left or right, it doesn't matter. But after an accident where your upper jaw is broken, my teeth were meeting at once, I can't remember which way it was round, but at one side and not at the other side. And that gave Jason another tricky problem to resolve. But he got round it, and in the end, there was just a little bit of tweaking in the very final appointment, and all of a sudden I could chew kind of simultaneously, because you can't be chewing at one side of the mouth and not at the other. You need to be able to, otherwise you're not using your teeth properly. And I think he said that on this side where the implants are, one at the front and one just to the side, it was important that the implant tooth not be the lead tooth in the bite. So if anything, he wanted my teeth meeting at this side just slightly, a fraction earlier. But in the end, he got it balanced. It's absolutely perfect. Very happy indeed. I feel as though I feel very, very fortunate to be a patient at this practice, to be able to turn to whichever of the three dentists who've helped me after this really awful cycling accident, and I feel as though I'm dealing with professional practitioners who are all at the top of the game, and I'm very fortunate to be a patient here. Apparently things like onlays and implants have a kind of shelf life, and I'm hoping that they're going to last for a long time, but of course if I do need the treatment doing again in maybe a decade's time or something like that, I'm not sure about the time frame, but obviously I would come straight back here, of course. If you're a human being living in East Yorkshire, you need to be at Edward House or at Brough Dental Studio, because the treatment is second to none.